Top 10 Prediabetes Symptoms. Do you suspect you might have prediabetes? Many individuals live with prediabetes unknowingly due to lack of awareness about its warning signs. Prediabetes by definition is elevated blood sugar levels, not high enough for a type 2 diabetes diagnosis. Various factors, including genetics, contribute to prediabetes. So understanding and managing prediabetes are crucial for diabetes prevention, and in this video, we'll explore 10 main symptoms of prediabetes. Let's get started. Number 1. Excessive thirst. Excessive thirst, also known as polydipsia, is a common symptom of prediabetes. It arises due to the body's inability to effectively regulate blood sugar levels. This happens because the cells do not respond adequately to insulin, and as a result, excess glucose remains in the bloodstream, leading to increased thirst. Now, let me explain in detail how this happens. The primary reason for excessive thirst in prediabetes is hyperglycemia, which refers to elevated blood glucose levels. As I said before, insulin is produced to help transport glucose from the bloodstream into the body's cells, where it is used for energy. In prediabetes, insulin resistance hinders this process. Consequently, increasing blood sugar levels. The kidneys also play an important role in this process. Hyperglycemia can lead to a phenomenon called osmotic diuresis. This occurs because glucose in the urine creates an osmotic effect, drawing water from the body into the urine. The body begins to lose more water, and this loss of fluids triggers a sensation of excessive thirst. As the body loses more fluids through frequent urination, dehydration triggers the body's thirst mechanisms as a way to prompt an individual to drink more fluids to compensate for the loss. In response to elevated blood sugar levels, the body may release hormones like vasopressin, an antidiuretic hormone, in an attempt to reduce urine production. However, the influence of these hormones might be less effective in prediabetes, and excessive thirst remains. Excessive thirst, as a symptom of prediabetes, can be a significant indicator of underlying glucose dysregulation. Recognizing this symptom, along with other signs, can prompt individuals to seek medical advice and take proactive steps to address their condition. Number 2. Cold hands and feet. This is not a well-known symptom of prediabetes. While cold extremities might not immediately raise concerns, they can serve as crucial indicators of the disease. This happens as a result of impaired blood circulation. Elevated blood sugar levels can damage blood vessels and hinder blood flow to the extremities. This reduced circulation can lead to sensations of coldness in the hands and feet. The nervous system helps regulate blood vessel constriction and dilation. In prediabetes, there may be an imbalance in the autonomic nervous system, which can cause blood vessels to constrict, reducing blood flow to the extremities and contributing to coldness. Neuropathy is another important factor in understanding the link between prediabetes and cold extremities. Neuropathy is a disease characterized by nerve damage that happens when high blood sugar levels harm nerves, which can lead to neuropathic symptoms, including numbness, tingling, and sensations of coldness. When the nerves that control blood vessel function are affected, it can result in poor blood circulation and the perception of cold hands and feet. This symptom should not be taken lightly, especially when it persists and is accompanied by other signs of prediabetes. Understanding the link between prediabetes and cold extremities can be life-saving. So, next time you experience cold extremities, consider it a signal from your body urging you to pay closer attention to your health. Number 3. Frequent urination. Frequent urination is also known as polyuria. It is a common symptom of prediabetes. The reason for this is that an elevated blood level, or hyperglycemia, prompts the kidneys to filter excess sugar from the bloodstream. This happens to maintain the body's fluid balance and electrolyte concentration, and when the kidneys detect excess sugar in the blood, they start expelling it through urine. This excess sugar acts as an osmotic diuretic, causing water to be drawn from the body's tissues into the urine. Consequently, individuals with prediabetes experience increased urine production. Just as I mentioned earlier, frequent urination is often accompanied by other telltale signs. Often, individuals with prediabetes will also experience increased thirst or polydipsia. This occurs as a result of the body's response to fluid loss due to excessive urination. To compensate for this loss, a person may feel a persistent need to drink more fluids, further aggravating the cycle of frequent urination. In addition to this, lifestyle factors play a significant role in the development of this condition. Obesity, a sedentary lifestyle, and poor dietary choices are primary risk factors for prediabetes. The increasing prevalence of these risk factors has contributed to the rising incidence of prediabetes and diabetes. It is important to know that weight management and physical activity are essential components of diabetes prevention and management. Losing excess weight can improve insulin sensitivity and glucose control. Regular exercise helps the body use blood sugar more effectively and reduces the risk of insulin resistance. Dietary modifications that focus on reducing sugar and refined carbohydrate intake are also vital. A well-balanced diet rich in whole grains, lean proteins, and vegetables can help regulate blood sugar levels. Frequent urination is a significant symptom of prediabetes, reflecting the body's struggle to regulate blood sugar levels due to insulin resistance or insufficient insulin production. This symptom, often accompanied by increased thirst, should not be dismissed, as it can serve as an early warning sign of potential glucose dysregulation. Number 4. Urinary tract infections. Urinary tract infections are infections that can occur in any part of the urinary system. In the context of prediabetes can weaken the immune system, making it less effective at fighting off infections, thereby increasing the susceptibility to UTIs. Let me explain in detail how this happens. In prediabetes, blood sugar levels are consistently elevated. High blood sugar can create an environment in which bacteria in the urinary tract thrive. This increased bacterial growth can lead to recurring UTIs. Elevated blood sugar levels often result in the presence of excess glucose in the urine, a condition known as glycosuria. This additional sugar in the urine provides nourishment for bacteria, making it easier for them to multiply and cause infections in the urinary tract. If left unaddressed, prediabetes can progress to full-blown type 2 diabetes. UTIs can thus be an early sign of a more significant health issue. When people can recognize the connection between frequent UTIs and prediabetes, it can help them take preventive measures. Frequent UTIs typically require treatment with antibiotics to eliminate the infection. Managing prediabetes often involves lifestyle modifications, including dietary changes and increased physical activity. These changes aim to reduce blood sugar levels and improve one's health. Number 5. Blurry vision. Blurred vision is a common eye condition where objects appear out of focus or unclear. When blurred vision is associated with prediabetes, the underlying mechanisms are related to fluctuations in blood sugar levels. In individuals with prediabetes, elevated blood sugar levels can lead to changes in the shape and flexibility of the eye's lens, causing vision disturbances. These changes result in difficulty focusing on objects and can lead to blurred vision. When blood sugar levels are consistently high, it can cause more severe and chronic eye problems, including diabetic retinopathy. Blurred vision is rooted in the impact of fluctuating blood sugar levels on the eye's structure and function. And I will give you a detailed explanation of how it works. Elevated levels of blood glucose, known as hyperglycemia, can disrupt the balance of osmosis in the lens of the eye. This disruption causes the lens to absorb too much fluid, resulting in swelling and alterations in its shape. This distortion of the lens's shape results in blurred vision as light is not properly focused on the retina. Hyperglycemia can also damage the small blood vessels in the eyes, affecting their ability to deliver nutrients and oxygen. This poor blood flow can lead to retinal damage and, over time, contribute to vision problems. Prediabetes can progress to full-blown diabetes if not taken care of, thereby increasing the risk of diabetic retinopathy. Diabetic retinopathy is a condition in which blood vessels in the retina become damaged, causing vision problems. Blurred vision can be one of the early symptoms of diabetic retinopathy. Blurred vision associated with prediabetes can be temporary and episodic. It often occurs when blood sugar levels are elevated and can improve once blood sugar is regulated through lifestyle changes and, in some cases, medication. This symptom is often overlooked, and individuals may attribute it to factors like fatigue, eye strain, or aging. However, recognizing blurred vision as a potential indicator of prediabetes is crucial for several reasons, such as early intervention, prevention of complications, and improving quality of life. Managing blood sugar levels effectively not only prevents diabetes-related complications but also improves one's health. This awareness can lead to an improved quality of life and better overall health. Both individuals and healthcare providers must remain vigilant and proactive in identifying and managing prediabetes. Number 6. Skin discoloration. Skin discoloration in prediabetes primarily results from the impact of elevated blood sugar levels on the blood vessels, nerves, and connective tissues of the skin. It can manifest in several ways. One of the most common forms of skin discoloration associated with prediabetes is acanthosis nigricans. This condition results in dark, thickened, and velvety patches of skin, typically occurring in body folds and creases. Acanthosis nigricans is indicative of insulin resistance, making it a clear sign of prediabetes. Prediabetic individuals may notice darkening or discoloration of the skin around the neck and armpits, which is often linked to insulin resistance and elevated blood sugar levels. Skin tags are small, benign growths that can appear on the neck, underarms, and other areas of the body. They are more prevalent in individuals with prediabetes and may be linked to insulin resistance. Several factors come into play when linking skin discoloration and prediabetes. The first is hyperpigmentation. Hyperglycemia, an elevated blood sugar level, can stimulate the production of melanin, the pigment responsible for skin color. This can lead to hyperpigmentation, resulting in dark patches and discoloration in affected areas. Another factor is inflammation. Prediabetes often leads to chronic, low-grade inflammation in the body. Inflammation can damage blood vessels and skin tissues, contributing to skin discoloration. Insulin resistance, a hallmark of prediabetes, disrupts the body's ability to regulate blood sugar effectively. This, in turn, can affect the health of the skin and lead to changes in its appearance. Recognizing skin discoloration as a symptom of prediabetes is crucial for early detection and preventing complications. If left unmanaged, prediabetes can lead to various health complications, including heart disease, nerve damage, and eye problems. By addressing prediabetes early, individuals can reduce their risk of these complications. Number 7. Slow healing cuts. One of the lesser-known symptoms of prediabetes is the delayed healing of wounds, cuts, and sores. In prediabetes, hyperglycemia can negatively impact the healing process. Wound healing involves 3 primary phases. The first is the inflammation phase. During this phase, the body's immune system responds to the wound. Hyperglycemia can cause excessive inflammation, impairing the immune response and delaying the initiation of the healing process. During the tissue formation phase, the body creates new tissue to replace the damaged area. High blood sugar hampers the body's ability to form new blood vessels, which are essential for delivering nutrients and oxygen to the wound site. This deficiency in blood flow can significantly slow down tissue repair. and in the tissue remodeling phase, the new tissue matures and strengthens. Persistently elevated blood sugar levels can interfere with collagen production, impairing the strength and integrity of the healed tissue. One of the challenges of identifying slow-healing cuts and sores as a symptom of prediabetes is that they can easily be dismissed as a common occurrence. Many people experience minor cuts and scrapes in their daily lives, and these typically heal quickly. However, when wounds linger longer than expected, it is essential to consider the possibility of an underlying health issue. So, the next time you notice a cut or sore that won't heal, take it as an opportunity to assess your overall health and take proactive steps toward a healthier future. Number 8. Dry mouth. Dry mouth refers to a condition in which the mouth lacks saliva, leading to a feeling of dryness and discomfort. In prediabetes, this is not a well-known symptom, but it can be a warning sign. One of the key factors connecting dry mouth to prediabetes is the altered glucose metabolism in the body. Hyperglycemia can affect the salivary glands, which may result in reduced saliva production and, consequently, a dry mouth. People with prediabetes often experience increased thirst. This can lead to increased water intake, and the frequent urination that accompanies elevated blood sugar can cause dehydration. Dehydration can exacerbate dry mouth and worsen the discomfort associated with it. In some cases, individuals with prediabetes may be prescribed medications to manage their condition. Certain medications, particularly antihypertensive drugs and diuretics, can cause dry mouth as a side effect. This means that dry mouth can be both a symptom of prediabetes and an adverse effect of its treatment. Dry mouth can lead to a range of oral health complications, including dental cavities, gum disease, and bad breath. These problems, if left unaddressed, can contribute to the overall health burden of individuals with prediabetes, as they may be more susceptible to infections and other complications. While identifying dry mouth as a symptom of prediabetes, it is important to know how to manage this condition. People with prediabetes can take several steps to alleviate dry mouth and improve their oral health. Maintain good oral hygiene by brushing and flossing regularly. Using an alcohol-free mouthwash can also help prevent dental cavities and gum disease. Avoiding tobacco and alcohol, which can contribute to dry mouth and oral health issues. Quitting or reducing their consumption can improve overall oral health. Prediabetes is a widespread health concern with severe consequences if left untreated. While it is often considered a silent condition, it can manifest itself through various subtle symptoms, one of which is dry mouth. Recognizing dry mouth as an early warning sign of prediabetes is critical. It can lead to early diagnosis and intervention. Dry mouth is not merely a trivial symptom but a potential indicator of a more profound underlying health issue. By understanding its significance, we can take steps to identify, manage, and ultimately mitigate the risks associated with this growing health epidemic. Number 9. Fatigue. Fatigue is typically described as an overwhelming sense of tiredness, lack of energy, or physical and mental exhaustion. In the context of prediabetes, fatigue can manifest due to several reasons, one of which is insulin resistance. When the body becomes resistant to the effects of insulin, it becomes less efficient at using glucose for energy. This can result in decreased energy levels, leading to fatigue. Blood sugar levels may also fluctuate more than normal, and when blood sugar levels are too high or too low, it can lead to feelings of tiredness and fatigue. These fluctuations can occur as the body struggles to maintain glucose balance. Many people with prediabetes experience disruptions in their sleep patterns. This could be due to frequent urination, night sweats, or other factors related to blood sugar levels, leading to poor sleep quality, which can contribute to fatigue during the day. As I mentioned earlier, prediabetes is associated with chronic low-grade inflammation and increased oxidative stress in the body. These factors can lead to fatigue. That's not all. People with prediabetes may also be more likely to experience fatigue due to lifestyle factors. Poor dietary choices can contribute to weight gain and a lack of energy, exacerbating feelings of fatigue. Effectively managing fatigue in prediabetes requires a multifaceted approach, such as adopting a balanced diet that focuses on whole foods, fiber, regular exercise, and weight management. Also, learning how to monitor blood sugar levels regularly can help identify fluctuations and make necessary adjustments to prevent fatigue associated with unstable glucose levels. Fatigue, while a common and often nonspecific symptom, can be a crucial indicator of underlying health issues, including prediabetes, so it's best to pay attention to your body when you notice you persistently get tired. Number 10. Unexplained weight loss. People with prediabetes may experience weight loss because of the body's resistance to insulin, making it more challenging for the body to store glucose as fat while also limiting its ability to use stored fat for energy. As a result, the body may start breaking down muscle tissue for energy, leading to weight loss. Elevated insulin levels can trigger hunger and cravings, leading to increased food intake. Paradoxically, even though the body is struggling to manage blood sugar, individuals with prediabetes may experience increased appetite and consume more calories. This can further exacerbate the imbalance between calorie intake and expenditure, resulting in unintended weight loss. While weight loss in prediabetes is not universally experienced, it is important to know it as a potential symptom. It is not the only reason for weight loss, but when it occurs in conjunction with other risk factors such as a family history of diabetes, poor diet, lack of physical activity, and being overweight or obese, it should raise concerns. It is important to emphasize that weight loss in prediabetes is not the same as intentional weight loss through diet and exercise. In prediabetes, weight loss occurs unintentionally, driven by the metabolic changes associated with insulin resistance. Intentional weight loss is a recommended strategy for managing prediabetes. The unintentional weight loss associated with prediabetes is typically gradual and may not be immediately noticeable. This subtlety can make it challenging to identify prediabetes based on weight loss alone, highlighting the importance of regular health checkups and blood glucose monitoring. The complexity of this metabolic disorder is not solely about high blood sugar levels but involves a cascade of physiological changes that affect multiple aspects of health, including body weight. Weight loss can be a symptom of prediabetes, and although it is not as commonly recognized as other symptoms, it is important to pay attention to yourself when you notice unexplained weight loss, especially when coupled with other symptoms we have talked about. Preventing prediabetes is a joint effort involving both individuals and society. Understanding these symptoms or early signs can empower you to manage prediabetes, steering clear of the progression to type 2 diabetes, a potentially hazardous condition leading to various serious health complications. If you found this video informative, feel free to give it a thumbs up and subscribe to our channel to stay updated with our upcoming content. Until next time, thank you for tuning in.